Hello and welcome to episode 18 of Homeopathy Simplified. And today we're going to talk about using homeopathy with other medicines and treatments. That's a big subject, so similar to how we follow a remedy, a lot of the similar information is relevant. And that was covered in the previous episode. So I'm Jonathan Damonte, and if you're listening to these podcasts, you'll know that I was introduced to homeopathy by my father, who was John Damonte, and he was very influential in the resurgence of homeopathy in the 60s and 70s. And I learned homeopathy from his students, and therefore I feel a very close connection to his teaching and career. I also became a Bowen therapist in my practice of homeopathy, and as such, I developed a clinic focusing on chronic pain and disease. And I really looked for the most efficient ways of prescribing. And after 27 years, I have kind of come full circle, and I'm relearning my homeopathy in order to teach my knowledge, pass on my knowledge, I should say. I've made that a purpose of a course that I've introduced called Homeopathy Simplified. And it's the course I wish I'd had in the very beginning of my career. And it's a course created to make the complex simple and shine a path through a forest of ideas and misconceptions. So, using homeopathy with other treatments. And just to look at the dictionary meaning of treatment, we see that it means management and care to prevent, cure, ameliorate, or slow the progression of a medical condition. So a really important description. So what are the types of treatments that we might be using? Of course, we're going to have medications, pharmaceutical and nutraceutical. And the pharmaceuticals, we would think of automatically of antibiotics, analgesics, nervines such as gabapentin and SSRIs, anti-anxiolytics. And then in the natural world, we'll think of things like essential oils, herbs, vitamins, enzymes, digestive enzymes, methylated vitamins and nutraceuticals, probiotics even. And then in physical therapies, we might put into that all the body work, chiropractic, acupuncture, craniosacral, even a TENS machine, laser therapies, and even minor surgeries, dental work, biopsies, curettage. All of that would be under the physical therapies. And then lifestyles, so from dietary to counseling, so whether fasting, cleanses, juicing, then counseling, psychotherapy, mesmerism, I put that under the sort of spiritualism umbrella, as that's a lot of therapy that's available now. A lot of people seek that and get value from that. So why do I introduce these as being important? Because each of these are an intervention into the natural function of the body's vitality. The body's vitality is that which wants to make it well and maintain wellness. So whether it's an effect on the immune system or the responses psychologically, these are all things that might change that and therefore have an influence on the way the symptoms of the illness, the imbalance in the body, is expressed. So we need to be aware of all these factors. And I might add in other outside influences, environmental. So we know that hot and cold can affect the health, the work situation, electromagnetic fields. We know that now. We're all toxics from PFAS and heavy metals in our environment now. These could be affecting, the body, let alone infections from the environment, whether it's a virus or bacteria. Anyway, so I want to remind us about how to follow a remedy, basically. This is important because it applies not just to the remedy, but also to these other treatments. So, for example, if we're so this is a chart explaining, I should explain this first, chronic disease on the left an acute disease on the right. So let's first look at chronic disease. How do we use this information of the chart? What are we looking at when we take a remedy in chronic disease? So we take the remedy and we wait. How long do we wait? Well, up to 3 to 6 weeks would be very common in chronic disease. And what is chronic disease? Any disease that's been around for longer than 3 weeks. So it could be psoriasis, it could be a blood poisoning, any sort of illness that's longer than 3 weeks. So here we have the 3 parameters of what might happen after we take the remedy. The symptoms could improve, worsen, or there's no change. In the case of symptoms improving, we would wait. And if the symptoms worsen and the symptoms of the disease are the same, we repeat the remedy. If we wait and the symptoms return and there are new symptoms, we'd want to retake the case because it's a new symptom story that needs to be addressed, perhaps the same remedy, but perhaps another remedy. In the case of symptoms worsening, wait. This is chronic disease. The remedy action could be slower than you expect. But if you're anxious, just simply retake the case. Be sure of your prescription. Depending on the timeline, if it's 3 weeks and there really was no change, you'd definitely be in this situation of retaking the case and maybe giving another remedy. Again, no change, you simply retake the case. So this is how we look at chronic disease. And in acute disease, it's exactly the same, but a couple of variations. We wait, the symptoms might improve, worsen, or there'd be no change. In the symptoms improving scenario, we wait until either the symptoms worsen or new symptoms appear. If the symptoms have gotten worse and they're the same as before, we'd repeat the remedy. If we hear about new symptoms, we would check on them and make sure that the remedy you're giving fits the symptoms. And then if symptoms worsen, we wait because symptoms might improve, in which case you'd wait again. And of course, same thing, if they worsen, retake the case. And then here, if there's no change, and you're sure of the remedy, you might repeat, wait again. If there's still no change, you retake the case. So very basic. Okay, so what can we learn? That following the symptoms changes or non-changes guides the use of the remedy. We're either waiting, repeating, or re-prescribing. And what are the questions when you involve other treatments? So if the other treatment applied has any effect, how can we measure that that in relation to a remedy? And consider in section B here that other treatment could be life-saving and be absolutely needed. And, you'd have to consider that. So these are all questions. And let's look at some scenarios. So in a patient you're treating with a chronic illness, suffers an acute infection. So this scenario could well be accompanied by a homeopathic remedy for the following reasons. The chronic treatment's effect on the patient is already established. In using a homeopathic to treat an acute infection, we can still follow the 2 effects. The effect of the chronic remedy is established and we can rely on that. And then we can follow the changes from the treatment in the acute scenario where we give a remedy for the acute condition. In this second scenario, B, the patient is treating an acute infection with another medicine. So maybe they've got pneumonia and they went to get checked by their doctor and for sure they've got walking pneumonia. And should they or shouldn't they take the antibiotic rather? And not for me to judge or say yay or nay, it's not the point. It's a diagnosed condition, there is a treatment for it, why would they not take it? So they take the antibiotic. Is it a situation that we can use homeopathy as well? So it's not, because you really can't have that situation of two medicines trying to treat the same thing when you're a homeopath. In another sense, the allopathic medicine, maybe the antibiotic, are considered to be suppressive to the vitality of the individual compared to homeopathic remedies that are curative, where one suppresses the vital healing responses and the second, the homeopathic, enhances the healing response. So in this scenario, you've got a push me pull you. One is suppressing, one is enhancing. And two directions are a negative in a body. You're better off using the prescribed medicine if it's been started or recommended, and then working with them later with what symptoms remain of their overall health. So the patient's under homeopathic care for a chronic or an acute condition. So if you're using homeopathy to treat these chronic or acute conditions, it may be necessary to add another treatment. And it can work in the same way as the scenario A, where the effects of the remedy are known and therefore the effects of the other treatment, medicinal or therapeutic, can be measured or evaluated. In my own practice, that was very much the case, where I would give Bowen therapy for, let's say, sciatica, and maybe after 2 or 3 visits of that, a remedy is introduced to help support the patient in between physical therapy. And, the body takes time to recover from chronic conditions. So condition type examples. So in pain conditions, infectious conditions, and emotional and nervous system disorders. So for A, you might have, let's say, a tooth infection. And the nerve is inflamed, there's a big abscess, and why would you not, in such an acute situation, give a remedy and get a prescription for an antibiotic? Because the consequence could be losing the tooth. Now, many people might believe that a root canal is worse than losing a tooth. Fine. That's an opinion, and I don't have one. I think most people would prefer to keep a tooth than lose it. And so if the infection is so bad, maybe the inflammation is so great that it can't come down until a remedy or the antibiotic has effect. So in that instance, you might give a remedy that is for the pain and inflammation, recommend they get a prescription for an antibiotic, and then they would be able to treat the tooth once the inflammation is down. And they'll also need maybe pain relief in that circumstance. Just because it's not natural doesn't mean to say that it's not valuable. And, we know that emergency care can be very, very important. And so as a homeopath, don't ignore those options. So then another scenario of infection is a cystitis, or a viral chest infection that I've already mentioned with walking pneumonia. It's not the virus that caused the cough. It was the virus that caused the cough, not the bacteria that is the walking pneumonia that would respond to the antibiotic. So, understanding a little bit of what you're treating is important as well. Even in a cystitis, where is the inflammation and pain? Maybe it's in the bladder, maybe it's not. Maybe it's just in the urinary tract. And so we might not recommend a antibiotic, because it could be just a very minor infection. If it's oftentimes those things have already been treated with antibiotics and are recurring, so it's a chronic disease. Maybe they're using D-mannose and other formulas for bladder infections without success. So here we really need to consider, what is the scope of homeopathy? Can homeopathy treat a bacteria? And I would say yes, very easily. And so with the urinary tract infection, homeopathy is an excellent option. So emotional and nervous system disorders, so things like sleeplessness, insomnia. Maybe the person is on a sleep medication, trazodone or something strong like that, and they cannot sleep without it. So can you add homeopathy? Yes, if you're treating their overall condition rather than their sleeplessness in specific. So, you can do their full case and add in a remedy. Now, sleep's so important that maybe they need to stay on the remedy and only might consider coming off the sleep medication if their overall health improves and changes things enough to give them confidence in the homeopathic remedy. My advice to people is just do the cold turkey if you're not so dependent on that medication. Just go cold turkey and opt for homeopathy. It'll be much clearer if and when the homeopathy works. So things like anxiety as well, exact same idea. And then acute conditions like shock and anger, definitely you can use homeopathy as well. Much better you use Ignatia than lorazepam, if the symptoms fit. So why do we care? We care because aggravations happen with homeopathy. We can easily aggravate an acute exacerbation of a chronic illness or even an acute condition. And we need to be clear about the action of the remedy, because sometimes we get confused by whether the remedy did this or the lifestyle did this or the medications did that. And so we need to be absolutely clear. And then the worst thing that can happen is that you lose the case where the symptoms are so deranged that only strong medications can calm them. And in that scenario, you're in trouble because the symptoms are then deranged by medications and or homeopathics in combination. And then to get to the bottom of the case becomes very challenging, especially when they get more complicated by the addition of stronger medications to treat the symptoms that are so exacerbated. And it's a sad situation when that happens. So in summary, homeopathic treatments are never as simple as they seem. They always require careful thought for the choice of a remedy and careful assessment following a dose. And then an analysis of what is the condition, what's the prognosis of that illness, and also what is the tolerance for the situation to wait a little bit if you're applying a homeopathic remedy instead of a medicine or another treatment. So just a reminder that the next classes will be happening soon. If you want to learn a good foundation for homeopathic success and a reliable and fast system of choosing and managing illnesses with homeopathy, go to Homeopathy Simplified and sign up for the newsletter. And best to do it that way because soon there'll be an announcement with some special offers. So thank you so much for listening, and I really appreciate you.